Clonazepam belongs to a group of medicines called benzodiazepines. It's used to control seizures or fits due to epilepsy, involuntary muscle spasms, panic disorder, and sometimes restless leg syndrome. Clonazepam is available on prescription only. It comes as tablets and as a liquid that you swallow. Clonazepam works by increasing levels of a calming chemical in your brain. This can relieve anxiety, stop seizures and fits or relax tense muscles. The most common side effect is feeling sleepy, drowsy, during the daytime. Clonazepam is not likely to be addictive if you take it for a short time, 2 to 4 weeks. If you take clonazepam for more than 2 to 4 weeks, your dose will need to be reduced gradually before you stop taking it. Do not drink alcohol while taking clonazepam. There's a risk you can sleep very deeply and you may have trouble waking up. Who can and cannot take clonazepam? Clonazepam tablets and liquid can be taken by adults aged 18 years and over. It can also be taken by children from 1 month old for epilepsy. It's not suitable for everyone. To make sure it's safe for you, tell your doctor before starting clonazepam if you have had an allergic reaction to clonazepam or any other medicine in the past. Have myasthenia gravis, a condition that causes muscle weakness. Have sleep apnea, a condition that causes breathing problems when you're asleep. Have lung, liver, or kidney problems. Have spinal or cerebellar ataxia, where you may become shaky and unsteady and have slurred speech. Have, or have had, problems with alcohol or drugs. Have recently had a loss or bereavement, depression, or thoughts of harming yourself or suicide. Have been diagnosed with a personality disorder. Are trying to get pregnant, are already pregnant or breastfeeding. Are going to have a general anesthetic for an operation or dental treatment. How and when to take it? It's important to take clonazepam exactly as your doctor tells you to. You'll usually start on a low dose and gradually increase it over 2 to 4 weeks until your doctor thinks the dose is the right dose. Your doctor will tell you if you need to take clonazepam in one dose or split your dose so you take it up to 3 times each day. Ask a doctor or pharmacist if you're not sure how to take it. The usual dose for epilepsy in adults, the starting dose is 1 mg taken at night, increasing to 4 mg to 8 mg over 2 to 4 weeks. Epilepsy in children, the dose varies depending on their age. It will be increased gradually over 2 to 4 weeks. Involuntary muscle spasms, adults, the starting dose is 1 mg taken at night, increasing to 4 mg to 8 mg over 2 to 4 weeks. Panic disorder, 1 mg to 2 mg each day. Restless leg syndrome, 500 micrograms to 2 mg each day. If you're older than 65 or have kidney, liver or severe breathing problems, your doctor may recommend a lower dose. Take clonazepam tablets with a drink of water. You can take the tablets or liquid with or without food. What if I forget to take it? If you forget to take your clonazepam, take it as soon as you remember, unless it's nearly time for your next dose. In this case, just leave out the missed dose and take your next dose as usual. Never take 2 doses at the same time. Never take an extra dose to make up for a forgotten one. If you forget doses often, it may help to set an alarm to remind you. You could also ask a pharmacist for advice on other ways to remember your medicines. What if I take too much? The amount of clonazepam that can lead to an overdose varies from person to person. If you take too much clonazepam, you may get symptoms including poor coordination or trouble speaking, feeling sleepy, a slow or irregular heartbeat, uncontrolled eye movements, muscle weakness, feeling overexcited.